Hey, listeners, we're continuing our series of live bonus episodes from ViVE and HIMSS, where we sat down with industry leaders about innovations and digital trends that are making healthcare easier. Today, you'll hear from Travis Rush, the CEO of Reperio Health. Let's get to it.
All right, well, we're excited to be here on the floor with Travis Rush from Reperio Health. Did I get that right?
Yes.
Perfect. CEO and co-founder. Why don't you tell us a little bit about yourself and then tell us about Reperio Health for those that aren't familiar with it.
Sure. Thanks for having me, by the way.
You're welcome.
So Reperio Health is we've set out to be a new solution to preventive care. And, the rest of our life comes to us.
Sure.
Amazon, banking, groceries, restaurant food, everything comes to us except healthcare. Healthcare is the only industry we still have to manage our life around it, and that ends up with procrastination and also 100 million people in this country just ignore it because they don't have time and they feel fine.
I'll say even my pharmacy is 2 blocks down, and sometimes I'm too lazy to go there. I'm like, gosh, just deliver it, right? We're so busy.
Right. Yep. Exactly. So we're on a mission here to create a new kind of virtual care that comes to people when they're at home and ready to do it. And so the way this works is we have this kit that has a bunch of medical devices in it. They're already this is not a Theranos thing. The devices have been approved and have been in the market for a couple decades. We're just bringing already trusted medical devices that are in medical practices today, and we're bringing them into the home so people can do the tests themselves instead of waiting for that appointment that never is convenient. So they say, hey, I want to do this. I'm ready to do my annual wellness visit. We ship this kit to their house. It takes about 30 minutes. They get their blood pressure, heart rate, BMI, relative fat mass. And then from a finger stick, we're able to get their total cholesterol, LDL, HDL, triglycerides, and glucose. And all that data is available to them in 90 seconds from completing the test. So they're not waiting on labs and then having to book another appointment to talk to somebody about the results. We're trying to shrink what normally is a 6 to 8 week process into 3 hours, and you never have to leave your house.
Fantastic. What does I imagine there's like an app component to this? Like how do consumers who receive these boxes
that's actually
know what to do?
Really good point to bring up. So we've spent a lot of time. We've patented some technology that removes the technical need for consumers. They don't have to have any tech savvy whatsoever to be able to use this thing. We have people from 18 years old up to 80 years old completing our screenings without any problems. We have a 96% success rate.
That's fantastic.
Week over week, people getting through the process. So when it arrives, we have already pre-provisioned this thing with the patented technology that's in it so that it knows who you are before you even turn it on. So the second it arrives at your house, you log into our app. The app says, great, we know your kit's arrived. Let's go ahead and turn it on. And it gives you animations and some narration on how to do that. You open the kit up. There's a button you press in the center, and within 3 seconds, it just connects.
That's awesome.
You never have to go into your Bluetooth settings.
Like your Apple AirPods.
Yep.
It just works.
Right. And then as you go through the screening, the app is managing the connecting and disconnecting from each of the medical devices as you go through the screening. So you don't have to have 5 different apps that have 5 different interfaces to deal with multiple devices, and none of the data talks to each other. We're collating everything into a single platform.
As you're speaking, I'm thinking about my grandmother, who's essentially like an RPM cardiovascular program at home. She gets all these things come there. She always calls me to help her manage it.
Exactly.
She's up in Canada. Things are different here. But,
Well, speaking of Canada, we actually are talking to an organization. I probably can't name their name up there. So we're looking at doing a pilot up there. So and also in Australia at the moment. So we're starting to explore other parts of the world. We think there's value in this kind of access to care everywhere. Right?
Huge. We'll have to talk after the show about Canada specifically.
Yeah.
I'm curious, this space, to the outside looker, they would maybe put you in the remote patient monitoring space. Is that where you all see yourself, or tell us about that?
Yeah, we're trying to not get into that space. We feel like there's plenty of options and companies out there that are trying to figure out that remote patient monitoring solution in partnership with providers and health systems. So we're trying to get earlier in the healthcare journey for people, where we are identifying problems before they become something you now need to manage. 60% of the people in the U.S. are walking around with one chronic disease and they don't even know it. 40%, according to CDC, have more than one. And so, the key is finding these things before that happens. We all know that. Everybody says that. But it feels like nobody's doing anything about it. So that's what we're trying to do. We're trying to be that quick kind of tip of the spear approach, where we say, all right, let's go find the people and get them into some kind of remote patient monitoring solution to get ahead of the problem.
Typically, then, who would be your customers? Like, who are you selling to? Or I would imagine you're working with providers somewhere at some point.
Yeah, so at this stage, this is kind of a 3-phase approach that we're taking in developing this solution. So the first piece of this was the kit itself. So before doctors, providers can do anything, they need data. It's really hard to solve a problem just from a conversation over a telehealth visit. Ultimately, you end up having to say, hey, we're going to need you to go run some tests so we can get some data to back up and support what we think we need to do. And that just delays the process. So our starting point was, let's figure out how to get data in the hands of people as quickly as possible so that they can make decisions that are informed. The next phase of this is now attaching a virtual visit on to the end of that. So we are currently in contracting with multiple large national payers to begin offering a virtual visit that is basically, if you think about an Uber driver, the way that this will work is when somebody finishes the screening, it will immediately reach out to all of the nurses or doctors licensed in that state, credentialed under that insurance plan, and say, hey, we've got somebody that's going to need a consult to talk about their health. Who wants it? And they'll claim it just like a driver claims a car.
That is awesome.
And they'll jump in and hop on and have a 15-minute conversation and say, all right, here are the things we've identified. Let's talk about your health history a little. We are also connecting into TEFCA through No2, one of the 7 quins at this point. And so we're able to also pull down 5 years of healthcare history into our system, no matter where you've gone before. And then we're also using AI to analyze all that data to summarize it for the doctor or the nurse practitioner to help them more quickly assess where you've been and align that with the data that just came out of our kit so that they can start having the conversation about now what.
What I love about your model, if I understand it too, is patients aren't necessarily purchasing this equipment,
right?
Or we've certainly seen that on our show.
That's key, actually. I think we keep hearing the buzzword access to care. We need to improve access to care, but I think one of the things that's being missed in that is there's a cost factor that's part of that problem, and you can't ask people to buy medical devices to then have in their home, and the insurance companies don't want to pay for them. So what we have done is come up with a solution that allows us to basically rent the devices to people so that they can get the data they need, and then they ship it back to us. We sterilize it, run some diagnostics on the kit, and get it ready to go out the door again. So it's literally the devices in a doctor's office in a box that we ship to you so that we're bringing the doctor's office to your home.
That's amazing. It's like makes me think of like the internet router model, where you don't, depending on who you're with, you don't necessarily actually own the router.
You're just leasing it.
They send it back when you're done.
Which is nice, because if it breaks, guess what? Somebody has to fix it, and it's not you.
Well, again, I won't say the name of the company, but I know some folks who bought their devices, they thought it was cool, and it just sits in a drawer, and they use it maybe once a year. And it's just a big sunk cost.
Exactly. Well, and I think the other thing that happens is people forget about it, right? It shows up in a box, they put it in a drawer, and until someone tells them, you need to do this, they don't ever think about it again. I think, we also signed a partnership with Uber to be able to deliver these kits in metropolitan areas at least. Let's say they're home on a Monday and they've got a few hours they're going to be home, they can decide right then, I I'm ready to do this right now, and an hour later, an Uber driver can drop off your kit and do your screening.
What would this cost then to like a patient? I realize they're not buying it, but it certainly depends on your contracting arrangements. But is this no more expensive than whatever their normal annual visit would be? Or
yeah, it's actually cheaper. So not only is it more convenient, it's cheaper. It's hard for anyone to say no.
Yeah.
The providers right now, on average, are paying around $500 to $600 for an annual wellness visit. So if you go to a doctor's office and have an annual wellness visit, that's typically what your insurance company is paying. So what we're doing is going to the insurance companies and saying, listen, we can do this for $250, half the price, and we're going to do it more efficiently because you only have so many exam rooms. We have an unlimited number of exam rooms. It's just people's living rooms. So, I think that's going to be a huge factor in making this more accessible again, because we're going to get the cost down and make it something not only do the payers like, they want.
I love it. I know we've interviewed a number of folks in value-based primary care on the show, and that is so important to them. If you can lower their cost and hopefully increase the engagement, get more of their populations to actually do the wellness visit, that should be huge for your business.
Yes, employers are, and I think we're seeing more and more of this, employers are starting to really understand their value in this ecosystem of healthcare, because they're the ones that have access to all of the people and are able to offer a seamless solution, because it's not a one-off purchase.
Right.
A company with 2,000 employees can get something in the hands of all of those people very quickly and inexpensively. It's interesting to bring that up. In Japan, there is a law that I forget what the name of the act is, but it's some act that was passed. It's a law that every employer is required to pay for an annual preventive visit for all of their employees.
Wow.
And as a result, they are the healthiest country in the world. Their chronic illnesses, I can't remember what the percentage is, but it's not even close. And we are the worst.
Yes.
And the cost of healthcare is the most expensive here.
Yes.
So it's all backwards.
Yes, totally backwards. Well, even Jared and I, in some of our predictions episodes, we were chatting about just the total incomplete misalignment of incentives, and we use GLP-1s as an example. I mean, this is total oversimplification, but as more people get on GLP-1s, it seems like it's having a negative impact on the insurer because of cost. Even though it's technically helping lowering BMI, so why aren't they being rewarded, right? So it just shows you it's a total disjoint industry here that someone needs to fix.
Yeah, I am always talking about the more we learn about the industry and all of the complexities around filing claims and getting approvals and going through all of those processes, it is a self-inflicted problem. In my view, this industry has created bureaucracy to protect their moat, and it is backfiring on them. Because now they've created something that they can't even afford.
Exactly. Well, I think one of my perspectives is like the healthcare value chain is so complicated. I would say even some of the most experienced healthcare leaders still don't understand the whole thing, right? And so they have no idea when they innovate on one side what the impact might be to the payer, to the provider, or to home health, or whatever. And I just think we're not giving us an excuse, but we're just an extremely complicated industry. I don't think any one person has it all figured out. So we create problems that we didn't realize are there. Awesome. Well, we appreciate you taking the time, Mr. Travis Rush. You'll have to come back and let us know how things are going as you continue to innovate and serve more patients.
Appreciate it. Thank you.
Thank you.